Shazli, welcome.
Thank you
very
so much for your time. Thank you.
Thank you. Please.
Thank you so much. Unfortunately, Pakistan is one of the 3 countries where polio still exists. It is the country where 44% of children are stunted and 50% of women are anemic. So to discuss about the health issues in Pakistan and what is the government and its stakeholders doing, we are here at WHO to have an interactive session with Dr. Assai, who's the WHO representative for Pakistan. Thank you so much, Dr. Assai, for your time.
It's my pleasure.
So to start with this, I would like to know, what is WHO first?
Well, WHO is a technical United Nations agency which provides technical support to the member states and on areas related to capacity building, on policy dialogue, setting norms and standards, evidence building, and different issues related to the technical capacity. WHO is actually, when we say WHO, it's a government and the secretariat. Yes. So we are secretariat, and when we get together with the government, then it will be WHO. So WHO is a technical agency, as I said, that really assess the situation of the health in each country. And we have an office in countries like Pakistan, which is the biggest country in the Eastern Mediterranean region. Okay. And our office is not only active in Islamabad, but also we have 4 offices in each province as our sub-offices, with a few technical staff who provides technical support based on the needs of the government.
So, Excellency, I would like to know, what is the specific work of WHO? Which is not specific, I know. It's
okay.
not.
As I said, a specific work, for example, we can start with monitoring of the progress of the programs. The issue that you have already started our interview with polio. How the polio really is going on. How many cases we have every year or every now and then on polio. And also assist the government on ensuring access of the people to the polio drops, organizing the campaign for polio. I mean, different activities on capacity building. If there is a need for research, which the policymakers make their policy based on the evidences, WHO is there. And of course, different levels of capacity building.
All right.
And to discuss about policy development and also the strategic setting, ensuring that the norms, standards, treatment protocols, which is available in the country, is based on WHO standards. These are just some examples of our interventions.
So what are the ongoing projects of WHO currently?
Well, we don't have projects. We have different programs, much bigger than projects. And the major areas that we are focusing are 6 major areas. One is communicable disease. All the interventions related to the tuberculosis, HIV/AIDS, malaria, hepatitis, and expanded program of immunization. So this is under category 1, which we have different programs going on in different parts of the countries. The category 2 is non-communicable disease, which we don't have much intervention so far, but we are planning really to assess the capacity of the primary healthcare facilities on delivery of non-communicable disease, prevention, diagnosis, and management. Assisting the government. Again, I would like to emphasize that we are only providing technical support to the government, and we are here for complementing what really government is required. The category 3, which is mainly focusing on the issues related maternal, neonatal, and child care. You know, Pakistan is one of the countries which has the highest maternal mortality,
Yes.
170 per 100,000 live births,
Unfortunately, yes.
or 55 of neonatal mortality. Neonatal mortality, I mean the death of the child under 1 month age. So many, measures can really prevent these deaths, starting from proper antenatal care during the pregnancy. So our category 3 is focusing on this issue. The fourth area is health system development.
Right.
Health policy, health financing, health service delivery, health information system, and research. And then there is another category for emergency preparedness and response, including outbreaks, disease surveillance and response, the emergencies man-made or made by the natural. And the last one is polio eradication.
Alright.
So polio also is a program. We have also programs on nutrition, on road traffic accidents, on mental health, but these are
AIDS,
all
malaria.
embedded in different categories.
Categories, all right. So before we move on to all the offices and have a tour of WHO office, I would like to know, what is National Health Vision Pakistan 2016 to 2025?
Very good question. The National Health Vision 2016-25 is a kind of roadmap to show that how government of Pakistan is moving towards universal health coverage and sustainable development goal, which is a commitment of all the governments by 2030. The National Health Vision, which I would like to provide you a copy of this, has 7 pillars.
Okay.
Pillars number 1 is focusing on governance. Governance means that the budget allocated for the health system.
Okay.
You know that the budget allocated to the health system is not really up to what we are expecting. The commitment of the government for allocating the budget. The issue of the regulating public and private sectors who are engaged in service delivery related to the health.
Right.
And also innovative management, improving the management at different levels. And finally, accountability mechanism. So there are issues in pillar 1, which is discussing, is related to these major areas.
Okay.
The pillar 2 is health financing. You know that only 0.06% of the GDP is the spending on health from the government, which is very low.
Very low. Very low.
And so many people really don't receive their healthcare facilities because of the poverty, because they don't have enough money. And I am very happy here to mention that government of Pakistan started a national health insurance program which given priority to the poorest of the poor, but covering only secondary and tertiary care and when they need to admit in the hospital, in addition to some chronic patients which needs, for example, renal dialysis, open heart surgery, and other, medical procedures. However, the financing is one issue that we need really, the government, according to the National Health Vision, needs to really correct it still. Correct it in terms of giving more share to the preventive care. 80% of the budget goes to the hospitals.
Yes.
While we can really pay enough attention to the preventive care, to the private. So more allocation will be given from now till 2025 to the preventive care. Also, capacity building of the frontline healthcare providers will receive more attention according to the health vision, in order to provide the better services. And the issue of the resource mobilization is very much important. Not government alone can really, with the government budget, can fulfill the needs for the people.
Exactly.
The pillar 3 is talking about package of health services. What services should be available in different levels of care?
Okay.
Who should deliver? How about the health workforce development issues? What are the incentives for the staff to work in the remote areas? How about the issue related to the health information system as part of the health system? Public-private partnership will be strengthened according to this, national health vision. And then health system resilience. Is our hospitals, healthcare facilities are really able to respond to any kind of the natural disasters? Is our health system able to respond to 40 or 50 casualties which comes to the hospital due to bomb blast or some similar issues? There is also a pillar specifically beside this for human resource development.
All right.
This is very important that human resources in Pakistan, we are facing really, some limitation for some staff in some areas, particularly in the remote areas.
Right.
So there should be some plan for projection of human resource needs during coming, years, 15 years. How many nurses Pakistan needs? How many midwives needs? How many neurosurgeon Pakistan needs in coming 15 years? And where they should be trained.
It's very important to identify all of this.
Exactly.
Yes.
And then plan for training and linkages between the universities and service delivery. And of course, the issue of the retention, development, and also even retirement of the health workforce is one of the major areas that is really we need really to emphasize according to this health vision. The other area is the issue of the health information system and research. The government of Pakistan is really emphasizing on strengthening district health information system. The country is huge country. The population in each district is big, and we have to build the capacity of the health information system at the level of the districts. Also the issues of the coherence and alignment between different healthcare providers. Is really private sectors providing enough information about notifiable diseases? And in general, we can say that establishing a central hub for information repository. The quality of research and researchers needs to be really emphasized.
Right.
The pillar 6 is about essential medicine and technology. Regulation of the medicine and technology. Availability of the essential medicine in all healthcare facilities. The proper use of the medicine, logical use of the medicines, and all the issues related to the medicine, pricing. And finally, there are some cross-cutting issues, like social determinants of health, like the gender equity, like the issues related to the One Health coordinated between different levels, between different UN agencies, between different partners. The issue of the joint efforts of different sectors. Health is not responsibility of only Ministry of Health.
Right.
We need really collaboration with the industry, with finance, with development, with safety, with security, with education.
And with the people themselves.
With the people. And lastly, I wanted to say that one of the areas that is in the cross-cutting pillars is community participation, community ownership, and community engagement in policy making.
Right.
So this pillar really has developed very carefully, very strategically, and to operationalize this health vision into action is some activities that WHO would be very much pleased to contribute to government.
This is a very interesting project, that a program that you guys are coming up
Exactly.
with, yes. And so let's go on to all the offices and see what's happening there and the other programs that WHO is
Sure.
going for.
You are
Thank
most
you so
welcome.
much. Thank you. So let's go.
Yeah, so most of the second floor are the polio staff are sitting.
Okay.
And the ground floor, mostly non-polio staff, and also our meeting rooms.
So Excellency, which room is this?
Yeah, I'm very happy to start with the health system cluster. You know, it is very important to tell you that most of the health service delivery and health related programs should be really delivered with a very well established health system.
True.
So let me to start with non-communicable disease. The staff, for example, who are working on non-communicable disease. Pakistan is a country that facing double burden of disease, communicable and non-communicable disease. However, the attention that has been paid to non-communicable disease is not to what we are expecting. For your information, it is important to mention 1 out of 4 of the people above 18 years are hypertensive.
Oh, that's huge.
Or 38% of the male are smokers.
That's a big number.
And these are all the risk factors for heart disease, for diabetes mellitus, for many non-communicable disease. And that's why 25% of the people above 40 years old, they have cardiovascular diseases.
Yes.
So non-communicable disease is preventable, but it needs a kind of intersectoral collaboration.
Okay. So what does this department do basically?
Yeah.
With that?
Now, the reason that we as WHO, we are really linking the non-communicable disease with the health system is that we aim to strengthen capacity of the health system and service delivery to also take care of the non-communicable disease. That's why I would like now to emphasize on the most important issues of the health system in Pakistan. Service delivery in Pakistan is fragmented.
Right.
We have huge number of the private sectors which really do not really coordinate as it is required with the Ministry of National Health Services regulation in the federal level and health departments at the provincial level.
Exactly.
We have different challenges related to the health workforce. The health workforce, particularly in the remote areas, are not really those really which we are expecting.
Right.
So the access to the services is really a little bit really fragmented. And also at the same time, the quality of care is not up to the standards that WHO is really proposing.
All right.
So our aim is really to build the capacity of the health system to deliver essential package of the health services, availability of the human resources, availability of the essential medicines, the healthcare financing, which is very much important. And here I am happy to mention that Pakistan during last 2 years have established a kind of national health insurance program for the first time, which covers 2.5 million of the poor. For the delivery of the secondary and tertiary care.
And this is the first time in the history of Pakistan.
This is first time health insurance. And this hopefully will continue for covering the whole population. And this is what really is the commitment of all the governments towards universal health coverage.
Right.
So one of the goals is really to reach the universal health coverage by 2030. So that health insurance is very much important to guarantee that the people are not really getting poor because of their health services.
So this team is helping you do that, huh?
Exactly.
Yeah, it's interesting.
One of the priorities in Pakistan, and not only in Pakistan, but also globally, is the issue of the polio eradication.
True.
There are only 3 countries in the world which still we have polio cases.
And
Pakistan, Afghanistan, and Nigeria. However, compared to 2014, which we had 300 polio cases, now till September 2017, we have only 4 cases.
Oh, that's a
So we are, towards really eradication of polio. However, you can see that the operation is very big. The people in the remote areas, in areas like, Kila Abdullah, Badin, all the Kachi Abadis of Karachi. Those are the areas which really access to the services is not easy. And that's why through community participation, through engagement of different healthcare providers, and a heavy, really, and effective machinery of the human resources covering all the people.
And they're all the volunteers of WHO?
No, they are, we can say, volunteers of the government. This is a government initiative, and we just provide technical support.
All right.
However, in this regard, we have a number of challenges. The major challenge is that population moving around.
Yes.
Nomads. The Afghanis who are in Pakistan and going and coming back, or vice versa.
Right.
The low level of the literacy of the mothers and fathers, that unfortunately we have still some areas that refuse the vaccination.
True.
Otherwise, if a mother knows that by 2 drops they can really prevent the baby become paralyzed, so definitely they will do.
True.
But the important issue is that they maybe the lack of awareness is the major issue.
Right. So what is WHO doing for the lack of awareness?
What we are doing here, we are coordinating all the activities. We have a strong partnership with different partners and UN agencies.
Right.
We are providing technical support. We have something about 600 staff across the country who are providing support to the polio program, team leaders. We have many national and international staff, micro planning, and of course, partners like UNICEF provide, for example, support for the vaccines. I would like to highlight some factors for which lead to the success of this priority program so far. The most important issue is government ownership.
Right.
That is very much important at the top level. So we have a focal point for polio appointed by His Excellency Prime Minister of Pakistan.
Right.
And full-time Senator Aisha is really supporting and leading the program. So that political commitment at the high level is very much important. When you go to the provinces, the chief ministers, the district commissioners, everybody is actively involved. Because this is a program that needs a kind of intersectoral collaboration. The army, the security are really fully supporting the program.
Okay.
Because there are areas, that in Pakistan that movement is not that much easy.
Easy, true.
So that's why we need really intersectoral. The other issue is really full support of the partners.
All right, all the stakeholders.
We have a center just, 500 meter
Yes.
above. We call it EOC, Emergency, Operation Centers. The representative of the UNICEF, the representative of the Bill Gates, the representative of WHO, everybody is sitting there, and there is an information center. And because the program is implementing through the active immunization and vaccination, so they have to know that what is going on every time. And also campaigns. Every month we have a campaign across the country. So they have
Campaign about polio.
Campaign. So giving the 2 drops of the polio to all the children every month, particularly in some areas which we have a problem, and we need really to increase the immunity of the community for this vaccine. In the last steps to eradicate polio, we would like really the role of the media on advocating for immunization. The vaccines are safe. The vaccines are really checked, all WHO standards. And I want to request all the people of Pakistan to trust WHO and accept to provide polio vaccination whenever the team coming to your home, or you are attending the clinics based on the guidelines and instructions that the healthcare workers are providing.
Right, and that's very important, and I think there is some knowledge that still people need to know in Pakistan to eradicate it, because even the 4 cases that have been registered, they can be eliminated. So
Exactly.
we need to work for it.
It's very important that the history of these 4 children has shown that they didn't have vaccination before.
True.
And that's why the poor child become, paralyzed.
And it's about the whole life of a child.
Exactly.
And it's about the whole nation too.
Exactly.
So it's important. So Excellency, which room is this?
Let us to walk and talk about one of the major priorities and challenges of Pakistan, and that is communicable disease and emergencies.
All right.
So WHO is providing technical support to the government on tuberculosis, malaria, HIV/AIDS, that we call it diseases of the poverty. So it has some root in the poverty, level of the income, the places that the people live, the places that the people work, and their behavior. So again, all these diseases are preventable.
Right.
And it is manageable. The good news is that if a person suffers from tuberculosis or malaria, it can be cured. But definitely it is better not to have these
them
diseases.
first, yeah.
Because unfortunately, due to different reasons, some of the patients or people are resistant to the treatments. So this
That is also
important.
due to lack of awareness, you think?
Well, no, because of the different factors, such as, for example, long-term use of these medicines, or the other factors in the environment. So, let me to tell you another important program, which is hepatitis. And it is very important to mention that 16 million people in Pakistan are suffering from hepatitis B and C.
That's a huge
This is
number.
alarming.
It is.
And it is very much preventable
Is
by,
it like one of the highest rated countries?
well, let me to tell you that Egypt and Pakistan constitutes 80% of the hepatitis in 22 countries of the region. So any action on reducing the prevalence of hepatitis in Pakistan will have impact on the regional, data. The disease transmitted through use of the, same syringe,
Yeah.
shared syringes between addicts particularly,
Yes.
use of the razors. You saw that many barber shops are sitting even in the streets and they
Under
are
the
using
trees, yeah.
the unsafe blood transfusion, which is very much important, and also many other factors that really infections, the issues of the use of the unsafe medical devices and instruments in the healthcare facilities. So we have really to make sure that really all the medical equipments that use in different levels, in the surgery, in the dentistry, all are very well sterilized.
Right.
And the people and the community should ask for that.
Exactly.
That is an
That's
issue.
their right. It's their basic right.
However, tuberculosis also is one of the high prevalent disease here in Pakistan. And then we can say that TB is a disease of the poverty because of the places that the people are living, places the people are, working, congested areas, bad housing, and not to start treatment on the right time. The same is with malaria. Malaria is a disease, is one of the vector-borne disease, which can be prevented if really the issue of the environmental health is very well considered. And that's why I want to come to this next priority for the country is environmental health issues.
Yes.
And not all the issues of the environmental health, sanitation, and water, safe drinking water is the responsibility of the health. It is not. There are some other departments. So it needs really a kind of very well planned and sustained intersectoral collaboration. Many diseases has root in the bad environment or unhygienic environment.
Right.
And that has to be considered by the policymakers.
So do you think like our government is doing enough for that?
Well, I think that it is not only a matter of doing enough, but it's matter that we have to see that who should be engaged, how they can really contribute. We need a kind of collaboration. Maybe each sector is doing their job well, but not in a coordinated manner.
Right. So where do you think they're lacking?
Pakistan is a country also, is facing emergencies.
Right.
Man-made and natural emergencies. And in addition to that, we have a number of the outbreaks which comes every now and then.
Yeah.
And that also is very much important. That's why we are now in this room putting the people responsible for communicable disease and also emergencies together to provide technical supports to the government of Pakistan. I would like to end our presence in this room by importance of integrated disease surveillance system. It's very important to strengthen our information system about the diseases and reporting system. And that is something that WHO is providing technical support. Just now, for example, we are facing some challenges in Peshawar and in Khyber Pakhtunkhwa on dengue, which really I would like to appreciate here the leadership of the provincial health department to really controlling the outbreak. However, there are many other issues that this team are really taking care and coordinating with the
How long do you think is it going to take for us to control hepatitis and tuberculosis, and how long is it going to take to end the emergency at least?
Well, nobody can answer this question. However, we have some goals.
Yes.
For example, I will just give you an example. We are expecting that by 2030, all the bloods are really tested for the issues of the hepatitis.
Okay.
So 100% of blood should be really properly cross-matched. We are expecting that above 90% of the people have access to the treatment of hepatitis. For each of these, there are some indicators. Now, where is the country and how? It depends on the government strategies, which maybe is next topic of our discussion on national health strategies from 2016 to 2025.
Yeah, okay. Thank you.
We have huge operation on logistics, administration, finance, and definitely, dealing with all these issues is not easy really. So we have some certain rules and regulations which the responsibility of our administrative officer, senior administrative officer, is that to make sure that all, the requests for recruitment, requests for procurement, and all the travels, everything is based our rules and regulations. In addition to this year in October, we are going to have one of the biggest governing bodies meeting of the WHO in Islamabad.
Okay.
So 22 countries will get together from 9 to 12 October in Islamabad. And the delegations are ministers and deputy ministers and high-level officials from Ministry of Health. More than 300 participants will get together. This is an annual meeting of WHO.
Okay.
And this also added to our routine ongoing responsibilities, which Nigel is leading it. So maybe some questions or maybe some very short description about his responsibility in this office will be helpful.
So Mr. Nigel, I would like to know what is your specific duty over here? Like, what are your key responsibilities?
Well, my role, my title is Administrative Officer, which means I am in charge of all the operations, the human resources, the finance, the budget, procurement, logistics, safeguarding of all the assets of the organization, and security as well comes under my remit. And when the money is given to us by our donors, which are from our member states or large donors, they want to know the integrity of how that money is spent, to make sure the money is spent correctly, and that's why we have the rules and regulations of the organization. And so my main role is to make sure that all of our funds are spent correctly in accordance with the donors' wishes, and to show the integrity of the organization.
How do you make sure of that?
So that's why we have huge numbers of rules and regulations which
Okay.
explain, how you can do it. So how a recruitment, to make sure the recruitment process, for example, is open and transparent. So if I had my private company that was doing that, I could employ my brother. There would be no problem. But this organization here, you can't employ a relative. That's against the regulations. But you must employ the best person qualified for the vacancy. So we would announce a vacancy, and we would receive all the applications, so everybody is entitled to apply, and then we assess against their qualifications, and then they go through a testing procedure and then an interview procedure, and then there's a board of people. It wouldn't be just my recommendation or Dr. Assai's recommendation, it would be a committee that would make the recommendation to the person, and that ensures we get the right person for the job.
Okay, so what is the biggest problem that you face in Pakistan?
In this office, it's a lack of resources to do the work, a lack of staff and that we can to carry out this, and the sheer volume, as Dr. Assai was saying earlier, we're the biggest country office in the region. We have a vast number of programs and activities going on. So the biggest is trying to do more with less.
What about security?
Security, we have a security officer and we have a security team, and we have also in the provincial offices the various security staff, and they ensure that all the activities are done in a way to protect the organisation's personnel and the organisation's assets, in coordination with the United Nations, which has a central security body. So security, it can be a hindrance for our access to certain areas in FATA, because we need permission, one, from the government in terms of a no objection certificate, an NOC, and also our own security to ensure their welfare. And things like the increase of costs, the requirements to be in an armoured vehicle, because an armoured vehicle costs, I can make 10 times more than a regular vehicle.
Yeah.
So that increased the costs and the difficulties of kind of things.
No, I
about
mean, like, you know,
government,
with their
but-
support, do you think there should be increased support, or do you think it's enough?
We have great support from the government,
All
but
right.
it can always be greater. The issue of visas for our staff coming in is something that we work regularly with the government to improve. The central UN system, Dr. Assai and his forum meets with the senior person of the
Right.
United Nations to facilitate their entry, and a better system of no objection certificates, NOCs, so
Yeah,
that we can go
that's
into
one
areas.
problem.
Let me to add to that, this is very much important, that WHO has a biannual work plan or a joint program review with the government of Pakistan. According to that plan, which signed every 2 years between Her Excellency Minister of Health and our regional director, all the program areas has certain and defined activities which should be implemented during these 2 years period.
All right.
If these activities are implemented properly, as it is planned, and within the budget space which has given, and on time, this means that we are in good position. So particularly when you are talking about administrative and finance, we are going to have a number of the consultants.
Yes.
We are going to bring, to send the people from Pakistan abroad for some capacity building activities. We are conducting a number of the activities inside the country, from research, capacity building, setting norms and standards. If really we in advance we predict implementation of this based on WHO rules and regulations, so definitely our administrative officer will be in a much safe position to support and expedite implementation.
True.
Exactly.
Thank you so much. Thank you.
Okay, thank you.
Dr. Ibrahim is the deputy to the polio team leader.
Okay.
So our polio team leader is now in Karachi,
Karachi.
and Ibrahim is. I describe about the importance of the polio and what we are doing.
Yeah.
So he has long experience. He was the team leader in Peshawar in Khyber Pakhtunkhwa,
Okay.
and we are making a kind of interview with Fire magazine, and we want really to
You
hear
to give your input.
very short that your views about what is the situation of Pakistan on polio
Polio.
eradication.
At this stage in Pakistan now, in the history of Pakistan, this is the time Pakistan has the lowest number of polio cases
Okay.
in the history,
That's
because
huge.
till now there are 4 cases, comparing to 16 the same last year.
Okay.
And the cases even reduced in 2006 and 2014 now to 4.
4.
But for us at this stage, even 4 cases are too many for us, because these cases now, one in Karachi, all 4 provinces. For example, one in Karachi, one in Punjab, one in Gilgit-Baltistan, and one in Balochistan. So the other thing which is also good is this, at this stage, the government of Pakistan is really taking the lead of polio program, because everyone working in polio now, they are working under one roof and led by the government. And the Prime Minister of Pakistan, even on 25th of August, he chaired provincial national task force meeting for polio,
Okay.
exclusively for polio.
Polio.
And then after that, attended by the chief ministers, chief secretaries, all key decision makers of the country. And then even on 7th, we were in Balochistan, attending the chief secretary meeting chaired by the provincial task force meeting. And now the government is taking the lead. We are near, but still we are not there.
There.
But this low transmission period, we are expecting that Pakistan will finish polio.
So, Mr. Ibrahim, just one question. Do you think that the number is going to increase in the next few months that we have for this year now of polio cases?
In last year, we have 20 cases.
Okay.
And this year, till now, we have 4 cases.
So are you expecting in the next 3 months that the number is going to increase?
When we are not expecting, it may be possible that one or few sporadic cases, but we are not expecting to be the same as even last year.
Last year, all right.
So we have, and again also we have environmental sample,
Okay.
which also shows also because of this huge population movement coming across Afghanistan, across from other provinces, virus circulation still we are detecting also in the environment.
Right. Okay.
You know, in simple language, the polio transmission has to be ended.
Yes.
So we are in war with this virus.
Okay.
And the government and the partners put the virus in the corner.
Okay.
Okay?
Yes.
However, we need still these few steps towards the end polio
All right.
to be really very much coordinated to ensure that those who miss immunization on this campaign are receiving the immunization. So when we add the polio vaccination through campaigns, the immunity of the community will increase and that virus in that corner will die.
That was a very... So where are we right now?
Very good question. We are in one of the priority program areas, a room which really provide technical support to the government of Pakistan on expanded program of immunization.
All right. And this is?
Dr. Hassan, Kamarul Hassan,
Okay.
is the medical officer for expanded program of immunization,
All right.
who is in Pakistan for the last 10 years with enough experience on the challenges we are facing on this issue. We were just talking about polio.
Yes. And it's eradicated.
And it is also very much dependent on how this team and also much bigger team across the country work on routine immunization. Each child needs some vaccination to be received during her or his first 5 years.
Yes.
These vaccines are safe, free, available.
Okay.
So our really request from the mothers and fathers is that approach to the health facilities and receive timely immunization as advised by the health workers.
And what is the biggest issue faced by this department, if I say?
Well, let me to say that what is the biggest issue that we are facing in Pakistan on full coverage. I believe one of the most important issue is lack of awareness, access
Right.
to the services, because we don't have enough primary health care. When I say we, I mean the government and the other care providers. There is not enough healthcare facilities, particularly in the remote areas or pre-urban areas, for delivery of services.
Okay.
The outreach team are not reaching those which really should be. Of course, we don't have much refusal for whole vaccines,
Right.
but anyhow, still there are some areas for refusal.
Okay.
And also we need really to improve collaboration and partnership with the private sectors.
Right.
Many of the people in Pakistan prefer really to approach the private sectors to receive the vaccines. So again, I want to emphasize the vaccines are safe, based on WHO standards, are free of cost, and we need really to ensure that all the children receive the vaccination. Polio eradication is really depend very much on how much our routine immunization coverage improve. So maybe some of the issues which maybe I missed can be highlighted by Dr. Kamarul.
Yeah.
So he can also add or contribute to what I said. Dr. Kamarul.
Yes, thank you, Dr. Assai. You said nicely. In Pakistan, a lot of children, they don't miss their vaccination and they don't complete their vaccination. That's a big challenge. It's the highest number of children remain unvaccinated in Pakistan if we compare in our region. and of course globally also one of the top country.
Yeah.
Now all these challenges that there is no service available in many places, that's true. But still, I really appreciate Pakistani parents that they come bring their child to initiate the vaccination.
Right.
Because we see about 80% they receive at least one dose. But this is not enough. 80% just one dose will not protect the child. Every child should receive all the doses. And to do that, every child should be brought to the EPI center or vaccination center at least 5 times during their first year of life and 1 time during the second year of life.
So it's total 6 times.
Yeah.
Okay.
Again, 5 times during the first year of life
Right.
and 1 time during the second year of life. Then the child is completed. This is one. And is remaining 20% who never come in touch. I request to them, this is you have to come to protect your child. If we 80% sounds big, but this is not enough to eradicate polio. This is not enough to protect our children from measles. This is not enough to protect our children from diphtheria. And we see many children in Pakistan suffer and die from this disease. Measles, diphtheria,
Yes.
whooping cough, and to protect them, to complete the vaccination.
Doctor, if I ask which, like those 20% people, which area are they belonging from? Like the main area, if you would say. Which one would it be?
It's everywhere and across all the classes. Yeah.
Okay. So there's no specific area which you may say that the service is not
we
being.
cannot say geographically this is more in these areas, or we cannot say this is more in rural area than urban area. No, it's everywhere.
All right.
Even in the big cities, they are one of the worst performing area in Pakistan. Though people are educated or they have better access to information, but for some reason, misconception or ignorance, they don't come for vaccination of their children, or they don't complete their vaccination of their children.
And can you highlight just 2 or 3 names where this vaccination process cannot be done because people are not collaborating or whatever? Any area in Pakistan specifically?
I can give you a recent example, like we had a measles vaccination campaign in Karachi just last month. Dr. Assai, myself, both were there, and we heard a lot of parents, they refused to get their children vaccinated.
Even in a city like Karachi.
Yeah, their perception was their children were already vaccinated, that's why they don't need any more vaccination. Their perception was their children already suffered from measles, that's why they don't need any more vaccination. This is wrong, absolutely wrong. Even if a child was vaccinated before, when such campaign comes, your child needs to be vaccinated again. That's
So it should be
ensured
you who
guarantee.
should decide that
Yeah.
if he wants it again or
Yeah.
not.
Even if the child was suffered from the disease, still the child needs to be vaccinated to save this child from the future disease. So that's important to understand.
To answer a part of your question and to complement what Dr. Cameron mentioned, we cannot say from where we have less coverage. Actually, WHO is going to have a kind of evaluation of the EPI coverage by end of this year, and then we will come to know that what is the situation of the coverage in different parts. However, as mentioned by Dr. Cameron, it's very much dependent on the level of the awareness and feeling of the responsibility of the parents towards the health of their children. This may be in the city, this may be in the village area, and vice versa. You can find the people who are living even in the remote area and they spend from their pocket and they come to the cities or come to the centers which they can have access to these services.
But actually, when we talk about such diseases, it comes to our mind that maybe the areas where there's lack of awareness or, maybe people are not so educated about things like this, that's where this prevails. But it's very surprising to know that even a city like Karachi has this problem.
It's not only Karachi. Let me add here. I mean, this kind of misconception is more among educated or solvent section of the community.
That's very
It's a
surprising.
common belief that government products, what government gives, these are the cheapest and least qualified. But I am guaranteeing you, the vaccine government gives, that's the best quality available in anywhere in Pakistan. And it's not only the quality that's when procured, this quality is maintained all through the supply chain, from the national airport up to the child when it's received. So these are expensive vaccine, is a WHO pre-qualified vaccine. Storage, supply, handling, everything, this standard is maintained.
Alright.
And I would prefer for my child to give government vaccine than any other sources, because that ensures the quality and efficacy.
Here we have a small kitchen, which the staff usually comes for their lunch.
Okay.
And this land is belong to National Institute of Health,
Alright.
which has been, given by the National Institute of Health in 2002
To WHO.
to WHO. And then we built this building, which is located in a very nice, environment. And we really appreciate government of Pakistan for really supporting all health-related programs, including, this building and this land.
But this is a good place for lunch though. Yeah, the environment and the greenery
Yeah.
is good.
So, as I said, this two floors is not really enough for all the staff that we have.
Right.
So some of the staff are working in the connexes.
Okay.
So
And
we
these are-
converted these into the working areas.
Okay.
But I'm planning to
Build an office?
make an office, build buildings.
Buildings over here.
Yeah.
So you aim to do that? You yourself, you were going to take the initiative?
This is what's my plan. Yes.
Oh, okay.
And I have
And when
discussed.
is- okay.
I discussed with the NIH, and they are going because they have to provide us permission for any kind of the
Construction.
reconstructions inside this land, because I cannot sell here.
I know.
So
It's understandable.
It's for our work.
So what do you see it happening anytime soon in this year maybe? Starting.
I know. This year, I definitely know. Hello, how are you? See, our security, for
Security,
example,
all right.
people are locating here.
Okay.
This is our warehouse, and the history go back to the time that you had earthquake in Pakistan,
Okay.
and that was the place that we have started to build this warehouse, which is very much helpful and supportive to the logistics.
So it
that
was
is-
basically in 2005.
Yeah, but it was on 2005.
8 October.
But later on, really, again, even this warehouse renovated and converted into the same situation.
All right.
So,
So that was the initiation of the warehouse of WHO. This one.
exactly.
All right.
So it is important also the security of these warehouses because there are so many items, keeping here from medicine, computer, medical instruments, communications,
We can see it.
devices. So to ensure that there is no any accident or fire on this is very much important.
So how do you make sure of
It
that?
is, well, we have the security, we have the
But what about
measures.
the the thunderstorm day before yesterday or stuff like that? So it's all secured that way
course.
too? And these are for your personal use or for what?
No, for the government.
For the government.
Yeah.
This is WHO's main logistics center, and all the supplies that are intended for any emergency response or any health related response in the country, all the supplies are imported from outside to this warehouse.
All right. And what kind of items are there?
Mainly the items are emergency medical items, medicines, plus medical equipment and ITT equipment for support of offices and staff in the field.
Could you tell us about the security and how do you make sure the protection of all of this?
Actually, this warehouse, it is inside the WHO premises, which is fully guarded, you see, and we have CCTV cameras installed over. The access is restricted to the designated staff only.
Okay.
Nobody enters the warehouse without permission from the warehouse manager.
Can we stand on the other
Yes.
to
To show it.
Yeah.
These are emergency health kits.
Okay.
These are for emergency response of health, mainly used in the camps.
Okay.
And some, for example, let's say some earthquake or floods, we use these kits for medical response. We have polio eradication initiative response items, mainly markers. And
Which are, because each child should be
Okay, yeah, the
marked
mark.
the finger. So it needs a lot of, every month they have the campaign and they need,
That's a lot.
yeah.
So a lot of markers are needed
Exactly.
for that. I understand. And do you think that this area is enough for the storage, or do you guys require more?
Well,
You can tell.
actually, this is a transition warehouse.
Okay.
We don't store the medicines for a long time because these are intended for response in the field.
Okay.
So we receive, we verify, and we distribute from here.
Oh, yeah. Okay.
We only keep the contingency stock, emergency.
Okay.
you can see also that there are some items, the office, equipments.
Yes.
So
That's exactly what I was
some things
noticing.
new or even the old, because we are renovating some of our offices, and definitely we need to keep our old items here for some times before we sell it. So you can see that variety of the items are keeping here, and recording all these, electronic recording is not an easy task. So whenever I need at 8 o'clock in the evening, I send an email to Sardar that I want to know how many of these tablets or how many of these we have it. He immediately responds to me because
They have a
we
data.
have a system.
All right.
We have a system for recording and reporting. There are many even training books, training materials which keep here
Okay.
before distribution. Some of them may be also old, which has not been really, for example, if you see from here, there are a lot of photocopy machine, and I don't know, based on our WHO rules and regulation, how can we do? We can sell it, we can.
Exactly. These are office equipment which is out of order, obsolete. There is a process of disposing
Okay.
of fixed assets because these are recorded.
This
in the
process
WHO.
of disposal is very lengthy.
Oh.
So that's why we have to keep it.
Keep it.
I cannot say, okay, this is not working, and
Throw it out.
throw it out.
Okay.
Because this is a WHO property.
And what about, like, I mean, is there a system like every month or something? Is everything checked, whatever? Because, there are different things, maybe water, maybe
Not every
anything
month.
like-
I think
Actually, there is a periodic inventory check. We do it after 3 months internally.
Okay.
And at the end of year, a physical verification committee is assigned, which is not someone from logistics who
It's
are
from-
managing the warehouse. It is third party
Party.
who comes and who verifies the books according to the physical.
All right.
image.
and we have audit in November, an audit from headquarters and from outside, third party audit
All right.
are coming not only for the warehouse, for all our administrative and finance issues.
That's
And we should really be
even little things like punch machines and everything, files, everything's here.
everything should be.
Okay. This is very interesting.
Shukriya Janab.
Thank you so
Shukriya.
much. I saw the warehouse where nobody can enter.
Assalamu alaikum.
I explained to you that the interview should be like this.
Yeah.
So you should have started from your office.
Assalamu alaikum.
We have started.
Huh?
We
From
have
your
done
office?
it. I mean, this is the job. I started with the rooms of the
No,
different.
actually, so but my idea is, maybe I'm
Yeah.
Wrong, that the crux of your message regarding programming
Yeah.
should comes one-to-one from your side. What the WR is saying.
Okay.
Because it is for masses, it is not for
Exactly.
easy
And there was really, really good messages that he and some other program officers gave. So